Okay, the first thing I'm gonna do is send an invitation. We'll look at it and then we'll do the talk. Hmm.
There we go.
So I'm so sorry about it. This is my this is my data now, not a Wi-Fi, okay? We have a
Okay,
very
there you
big
go.
problem with the internet. Can you hear me now?
I can hear you perfectly. There were a lot of
Perfect.
hurdles to get here tonight.
Happy New Year, Carmela, and I think we are going to have a
Happy.
lot of technical difficulties for the rest of the year.
Yeah, my New Year's wish is that we have better connection in both our countries.
Yeah. The thing is, I took data, so here in Nepal it's like more stronger, and
Hmm.
I was not like sure about the Wi-Fi. Then I connected with
Hmm.
the data, but you were not able to like see my video or listen to me. Then I connected with the Wi-Fi, and I'm trying to send you the request, but it's unable to join. It says something like this. Anyways, finally we are
We're
here,
here.
and I cannot take guarantee that we can continue. But if we but if in case it does not happen, it's good. But if it in case happen, then we can still do the Zoom. I think it's like being a practice session for all of us.
Yeah.
My
Yeah.
God.
Yeah.
Okay, so how are you? My God.
I'm good. Yeah, I had work this morning. I got the rest this afternoon, and I'm here. How are
Wow.
you?
It's been a roller coaster ride for today as well. I had a lot of things in the to-do list. But finally we are here and we're able to talk. Let's see.
Yeah.
So in the last part, you gave us a little bit, an overview of how the veterinary profession is, having certain things with the mental health, and you also given the information about the stats and data. So when we talk about that, so what are the factors that are contributing to these, seriousness that we see in the mental health, especially in terms of veterinary profession?
So I came across this incredible study by Merck Animal Health in
Mm-hmm.
2018 while I was researching about mental health in the vet profession. And based on their study, they were able to highlight three main factors of many, of course. And the study is entitled Surprising New Findings on Veterinarians' Mental Health and Well-Being, and it's published in 2018 on the Canadian Vet Journal. So if you want to take a look, that's there. But just to give a short overview tonight, one of the main driving factors which they identified was the high student debt. So according to the data, the level of distress among vets with student debt was 9.2 to 11.3% as compared to only 3% in students without student debt. Now, I can't say that that is a problem in my country, uh, not for a good reason, but because students here don't normally have the option to take loans from banks for education. So the underprivileged actually don't have access to higher education, which is another problem, another conversation for another day. Is it a problem in your country, high student debt? Would you know?
Well, we don't have specifically in terms of, uh, a lot of times here in education is affordable. And when we talk about the veterinary, study, here what we do is like have government schools, government
Ah,
universities. But
yes.
then there's also the pressure because you have to prepare for the exams and give the entrance exam. But yes, we do have the facility of student loan, but it's not of a kind of a big deal. And the thing is,
Yeah.
a lot of education here is affordable. Yeah.
Oh, that's great. Yeah, we also have the option to do vet med in a government school, and I actually did mine in
Yeah.
the University of the Philippines. So that was really great. I know that it's a problem in the United States. I've spoken to some vets who have encountered that problem, and it's really tough. I mean, the financial burden alone, when you're out as a new grad facing all that pressure already, and then you have to think about paying your student loan. So
Mhm.
I can imagine how that's had a huge impact on mental health. Another factor that they highlighted, which is not surprising to me at all, is that younger vets were found to have had a higher frequency of distress as compared to older vets. And I know that there might be a tendency to scoff that up to generational difference, like, because you're a millennial, you're going through a lot of mental health issues. But I think that it's worth exploring further. And if I actually had time, I would do a formal study just to investigate, what's causing younger vets to have a higher incidence of distress. And for now, as a younger vet myself, I can rely on the experiences that I'm having, as well as the conversations I've had with fellow young vets. And based on my experience and the conversations we've had, um, I think that the distress comes from inexperience, lack of mentorship in some practices, high expectations, the steep learning curve, as well as lack of confidence, because we're doing so many things for the first time. And I've read and heard so many times from other vets that the first 2 years out in practice will be the hardest. And I think we just need to prepare ourselves for that. The Merck study also highlights the failure to seek professional mental help is something that requires attention by the profession. So, based on their study, 50% of vets with mental illness were not receiving treatment. And for me, that's alarming. And I think that there are two important hurdles to tackle in this regard. One is lack of access, and the second one is the stigma that's still surrounding mental health, which is really a major block for people who are struggling to seek the treatment that they need. Because if that stigma is still there, it's harder to reach out for help. So, yeah, I think though I agree with them that those three are the main factors which we should be tackling as a profession and as individuals.
Mhm. I think you put a lot of effort on that, especially the student loan and the kind of process it goes into it. Being a student who are like most of them are not financially independent, that can be definitely very overwhelming and just you know consumes a lot of things on your mind itself, and then you have to read the medicine for the whole, like, let's say 5 to 6 years down the lane, right?
Yep.
Yeah, yeah. And that is a different like chapter. um
Yeah.
so these are like very I think determining factors that is contributing to the mental health issue, especially in the veterinary field. When we talk about these factors and so how do we see we proceed as a
As a
community?
profession,
Yeah, as a
yeah.
profession.
I think that first and foremost, there is no single right answer to the problem. It's multifactorial, and I think it varies across countries and across regions because we practice vet med differently.
Mhm.
So one thing is for certain, we as individuals, we all play a part, and as a community, I think it's important to get our unique skills together and work together to move forward in a healthy manner. First, as in anything, I believe that awareness is the first step, just like we talked about in our first session. And for me, this promoting awareness will help put an end to the ridiculous stigma that's, that we also talked about. And we ought to encourage these conversations, such as this one, as a profession. And I do see that happening. So I think there is some positive change. Like, for example, I've been seeing a lot of mental health webinars being included in veterinary conferences. I attended one last year where in every morning they started with a mental health session. And that was actually a part of the CE, the continuing
Yeah.
education points that they, yeah. So I feel like not only in our profession is it an important, it's an important topic, but also in our personal lives. And this is why I personally am open about my mental health struggles, and not just the struggles, but the wins as well. And the reason I'm doing this is not to, gain attention for myself, but to help people feel that it is normal to struggle mentally and emotionally, because it really is as human beings, right? Um, so while I understand that not everyone is ready or comfortable to share, and I would never force anyone to share before they are ready, I feel that having these conversations is an important, stepping point to just more awareness.
Yeah, I think I truly agree on that. The awareness itself, because uh, personally for me, it wasn't until the pandemic where we were in a lockdown that uh, we talk, or like I had the closer to the mental health, the
Yeah.
awareness itself.
Mm-hmm.
And it was the social media, not only social media, that has a very negative impact. And but then we also get to connect with people, and like we're doing this conversation, and a kind of contributing to the awareness itself. And that is a very important part. And I also love the fact that how we should not be very pushy about it, because people might not be comfortable, right? Yeah,
Yeah.
a lot of times
Yeah. Super
they,
understandable.
yeah, yeah. And it can be a very big deal for people. It should be, but like you address that, it should be also normalized. It should be also become like a day-to-day talk. We hope that it should be
Yeah, I
about,
mean,
yeah.
yeah, like, can you imagine a world where someone who is struggling with mental health is able to, openly talk about it, just like, someone who is getting treatment for diabetes? Because honestly, they're both disorders. One is a disorder of, you know, of the kidney,
Mhm.
and the other is a disorder of the mind. So, and the brain is really one of the most nuanced organs in the body. So I don't get why there's a stigma surrounding it, really. So, yeah, so that's the first step. And I feel that as a new grad, I also have to vouch for establishing solid mentorship programs. And I'm also seeing that in our profession. So that's really exciting. And I just want to share that um, my conversations with friends, some of them have expressed that they feel they lack mentorship, while I also have friends who are excitedly telling me that they feel very guided and supported in their work. And I can honestly say for myself, and based on those conversations, that those who have solid mentorship in their practices do feel happier, more satisfied, and more at peace in their caregiving jobs. And I kid you not, I go to sleep at night and I wake up every morning thanking God for my mentors.
Wow.
Yeah. So, yeah, it's a big deal. And then I also want to add that, I've always had this idea that vet professionals and human healthcare professionals should have access to mental health counseling and coaching right in their workplaces. Like, I don't know about you, but have you ever wondered why, our friends in maybe corporate jobs have that option? Like, in their workplace, they usually would have an in-house mental health coach or counselor, or someone on retainer that they have that option to speak to a professional. And I've always wondered why we are not promoting that as much in the healthcare profession, both humans and animal practitioners, right? So it's such a high stress job, and there's so many demands, and I just feel like that can help so much.
Truly, truly,
Yeah.
I completely agree with you in the matter of access to these kind of mentorship. If someone is dealing here in Nepal, I have to be honest. I don't know where to seek for help. I might go to my friends, but my friends would not relate in the way that I am dealing, because
Mm.
we don't share the kind of profession. But I think it would be much better if we have someone speaking, or someone having from the same kind of background. I think that way we can more relate, but not always. The kind of professional mentorship is very much important. So you also mentioned about how it's a very high stress job, the medicine sector itself. And in talking about mental health in the veterinary profession, we also come across about the, let's say, the topic like compassion fatigue. So can you please give us a slight information on what is
Yeah.
that?
Yeah. So I agree with you. Compassion fatigue, I think, is one of the heaviest topics in vet med, and I can't say that I've experienced it myself yet, and hopefully never. Hope and prevention is always better than cure. So the good thing is we're both aware of compassion fatigue, so we can be able to prevent it. Uh, so Schwam defines compassion fatigue as the emotional burden that healthcare providers may experience as a result of overexposure to traumatic events that patients experience. And I think it's pretty self-explanatory with that definition itself. Healthcare providers, both animal healthcare providers and human healthcare providers, were exposed to illnesses and suffering almost on a daily basis.
True.
And, apart from that, I feel that the people who are drawn to the veterinary profession in general are highly empathic people who have great drive to provide care and help. So, if all that empathy is being used every day and you're exposed to so much suffering, then you are at risk for compassion fatigue. And some experts even say that compassion, or even refer to compassion fatigue as an occupational hazard in any caregiving profession. So yeah, and another thing I noticed based on my experience is one of the most common misconceptions about the veterinary profession is that, we're always just cuddling cute patients like 24/7. And, these patients love us back, and we get so much love from animals, and it's this cute place. And while, yes, I love my job and I believe it's a magical place. Most of the time, the reality is, it's not always cute patients who love us back. Majority of at least small animal work is treating patients who are terrified of you and who want nothing to do with you,
True.
and delivering bad news to clients. Dealing with cases that are cruel, like kidney disease, and seeing patients suffer. And these, our patients can't talk. So you're seeing them and you obviously want to help them. And it's just, sometimes that can be stressful. And we also encounter uh, our clients who struggle to meet with their pets' needs, may it be because, they can't afford it, even though they really want to, and we have to help them still. So, yeah, I think that all of these things are contributing to compassion fatigue. And based on the AVMA, uh, vets face ethical dilemmas at least 3 to 5 times a week. And that's one of the major driving factors um, to compassion fatigue. So yeah, it's a huge topic and it's definitely an important one.
Yeah. Thank you so much, Carmela, for highlighting that all things that needs to go. I think you like mentioned so many, small but yet very important details that contributes to compassion fatigue, and people needs to be aware about it. Um, the sooner you know that something like this exists, you are kind of aware about it. Um, and you also mentioned about the ethical dilemma, especially in the veterinary profession, when our animals, like when our patient cannot speak for themselves, and then the kind of things that we need to do on daily basis. Especially if I would like to share, when I was an intern in
Mm-hmm.
XX like organization, so my mentor was not there, so he had to be in a leave for maybe 2 weeks. And on that particular like let's say week, a dog got very sick and it has to be euthanized. And I was in my intern, and I was very naive to that, the whole euthanasia process. But I was under the guidance of that, but my mentor, and he told me to do it. And I was like, no, put on your brakes.
No, no, I
Yeah,
don't want to do it.
never. Don't make me do that. And he's like,
Yeah.
but because he's out of the, the organization, and he had a very critical case back at his home, so he wasn't available there. But at the same time, the patient also need the euthanasia thing. And it took me a while, an hour, okay, because there were no any other technical people to after like pushing the plunger. It had me got like for 2 weeks. I was on the verge of regret, guilty, and uh, even at nights I would be like, oh, the dog had to suffer so much. Was I the right person to do like that, push the plunger for that, you know dog? And it got me for like 2 weeks, and I'm still not over it. But having the conversation, like you said, having the mentor and talking with the people in this profession, I kind of like understood. But
Yeah.
these kind of
Yeah.
things can be very hard for especially for newly grad. And yeah, thank you for uh, you know talking about the ethical decision that we made in veterinary profession on like daily basis. The another thing I think you also mentioned about the compassion fatigue, is how it's really important to be aware about it. And it's a very very new term. If we ask in the veterinary profession, especially in Nepal, we don't talk about it. It's
Mm.
very rare. So even
Mm.
I knew about it from the internet, and research about it through the internet. So yeah, we lack that access, and I think it's a very important topic. So when we do that, what on your idea or your perspective is that how can we deal with this kind of anxiety? How can we lower this kind of fatigue in like daily basis? What's your point on it?
Yeah. First, I want to thank you for sharing with me and with everyone your own personal experience with euthanasia, because I don't think it can ever be easy.
No, yeah.
So I'm sorry that you faced that and that, that you had that sort of distress for 2 weeks. And at the same time, I'm glad you had your mentor. And I
Mhm.
hope that you were able to, gather support as well from people who are close to you. And yeah, I'm here if ever you need to talk and
Thank
if you
you so
ever
much.
have to do that again.
Mhm.
Um, yeah, so I'll share my own euthanasia experience later on,
Yeah.
but you asked what we can do to help cope with the emotional demand or the emotional effects of compassion fatigue and the factors contributing to that. And today, as I was reflecting on this, I actually came up with a memory aid,
Mhm.
and this is totally informal and just my own way of trying to remember, and I hope it helps, everyone out there. And I call it the take care of your cat. So it's CAT,
Mhm.
cat as in cat. C for connection, A for awareness, and T for training. And for me, seeking and nourishing meaningful connections has really helped me a lot in preventing compassion fatigue and burnout in general. So, as human beings, we were naturally designed and called into community. And as a professional, I feel that there are four realms of life giving connections that help us in our work. And the first one I want to highlight is our core vet friends. So these vet friends don't necessarily have to be in your workplace. They are, friends from school who you keep in touch with, friends from the Instagram community, friends you make across different practices. And personally, I have two vet friends from college who I still talk to almost on a daily basis. We share our struggles and our wins, and we also sometimes study together. And the first time I ever had to perform euthanasia, which was actually just last week. So this is so timely. Um, I immediately talk to them. Just the process of being able to share that with them and, not keeping it on my own just really helped me so much. The second one is friends outside of vet school. And I think they remind us that there's a life outside of vet med. There are people who love us, who care for our well-being. The third is connection with clients. And I think this is something that, doesn't automatically come to mind. But research has shown that practitioners with good and strong client relationships report more satisfaction in their caregiving jobs. And a large part of the good relationship we form with clients, apart from empathy, comes from effective communication, right? And that's not easy. So communication is something we often have to learn on the job. But if this is something that our listeners are interested in working on, I highly recommend the Consult Room Mastery course by the Vet Success Academy. I did it and it helped me so much. One of the things this course taught me is about my role as a vet. So it helped me to understand that my role is not the main decision maker. My role is to be that pet's advocate and my client's guide.
Yeah.
So, it not only helps me help them, but it takes the pressure off of, making those decisions. Because at the end of the day, you study so you can be a better advocate for that patient, and you strive to become your client's best guide, sort of like, as Gerardo calls it, their Yoda from Star Wars reference. Yeah, so for example, in the euthanasia that I performed last week, I remembered that I am doing this for that patient who has been struggling for a long time. And I made that recommendation to my client, who then will make the decision. So I don't make that decision for them. I inform them, in the best way that I can of, what I think is best for this patient. So that's really helped me, and I hope you guys check it out because it helps so much. And the last connection that I want to highlight is obviously the connections we form in our workplace, because we spend 7 to 10 hours a day at work. So that's a huge amount of time. And if our relationships at work are strained, it becomes incredibly difficult to deal with the demands of the profession in general. So that's C. Next is A, awareness. And we've talked about that. And if you're one of the tools that I've come across recently is the Professional Quality of Life Assessment on the AVMA website. It's a questionnaire that helps you be aware of where you're at in the stage of your profession. So it's quick, it's easy, and it just helps you sort of know where you're at emotionally and mentally. So check that out. And lastly, training. So boundaries training is so important. I feel boundaries is something we learn throughout our whole lives. And I feel it is important to train ourselves in that regard, creating healthy boundaries. And lastly, I think that universities should play a part in this. I feel like this should be part of the curriculum, taking
Yeah.
care of oneself, because we're so good at taking care of others, but when it comes to taking care of ourselves, we just don't know how. So yeah.
Quote that. I think
Huh?
we need to quote that. We are taught to care for others, but when it comes to ourselves, there's no one. I mean, wow. I
Yeah.
truly soak into that. We do lack, the curriculum itself lacks a lot of things for specifically
Mm,
for students, right?
yeah.
They prepare the students for 5 to 6 years, and they send it to the field and then say deal with it,
Go, go.
you know.
Yeah. Deal with it.
Yeah, just
Yeah.
go with it. It's your
Yeah,
life, you
yeah.
gotta do it. And we are so naive, and to the whole exposure itself can be overwhelming. Wow. And and people listening to here, you need to get a cat connection, awareness, and the training. Wow, that was a very good mnemonics. I think will help everyone to remember because
Yeah,
I
yeah.
got
I
two
hope that,
cats.
yeah.
Yeah. The connection part, I think I absolutely agree with you, because a lot of times we are projecting the kind of aura, the energy of people that we surround ourselves, and it's very important that we surround ourselves with the positive energy people who have vision and who are willing to talk about this conversation. And I'm very glad
Mm,
that you have that kind of friends in your circle and that you talk on daily basis. Yeah, that's absolutely so fabulous.
thank you. Yeah.
Wow. And also thank you for sharing that story about your and with the euthanasia. It's a very it needs a different I think conversation where you talk about yourself, the experience. So these were some of the things that you mentioned, which are very important. But in outside the periphery, in general life, what do you think we can address that will help to address the mental health in general?
Yeah. Things you mean we can do for better mental health.
Mm-hmm.
Yeah, so just last year, in this pandemic craziness, I attended a church webinar about mental health, and it was by, sorry, let me check the name. Priyan Max Jaganathan. I'm so sorry if I pronounced that wrong. He's one of the founders of Thinking Faith Asia, and I absolutely love what he said. And here's what he said: to be mentally healthy, we need to be aware of the physicality, relationality, and spirituality of our mental health. And the physicality of it includes both our mind, our brain, and our bodies. And the relationality comes with our relationships. So, are our relationships healthy? Are they toxic? Um, and the last part is the spirituality, which is, I think, something that is often neglected. We forget that that's also part of, the human being in its full essence. So I agree that in order to be mentally healthy, we need to develop practices that nourish our minds, our bodies, our relationships, and our souls. And I learned this the hard way. Just to make the long story short, I inadvertently took a gap year after graduation. Inadvertently, because I didn't mean for it. It wasn't planned, but it sort of happened that way because, one, COVID, and two, I honestly had a really tough time mentally. I would even call it a breakdown. So, I was always a full steam ahead kind of person, but I'm actually glad that, God put a brake on my engine, because in that gap year, I took care of my body for the first time. I changed my diet completely. I I sought the help of a functional medicine doctor, and he really helped me get on track in terms of my health because I was neglecting it for so long in vet school. And, I had all these problems, which I just kind of like put in the back of my mind because, I was studying and, this is what's important. So, yeah, I finally had some time to address those physical health concerns. And in that gap year, I practiced journaling for the first time as well. Um, that's something that's really helped me cope with my anxiety. Journaling is awesome. I highly recommend it. And in this gap year, I also became or leaned in closer to the Lord, which, spiritually has really nourished me. And that has flowed into my other relationships. So I was able to love others better as well as create healthier boundaries. So different things work for different people, but I would encourage to see what works for you while not forgetting the holistic nature of mental health.
Wow. I think you like everything that you're talking about is so much important. I'm just soaking in, the kind of tips that you're giving us, and relating to it because I absolutely agree on that. The relationality and again with connecting with people, the physicality, because a lot of times, like you mentioned, the study is the main priority for us. We can deal with everything later. It has to be done with the good grades. It has to be completed on time. Everything, the pressure is there. And you mentioned about how you find journaling very, soothing.
Mm.
If someone is starting new with journaling, and it's 2022, by the way, so if they have something up with journaling, what are your ideas on that? I think it would be very much
Okay.
helpful.
If you're new to journaling, I would recommend starting with a brain dump. So what that is that's the practice of dumping all the contents of your mind in your mind onto a piece of paper. And I know that, sometimes for some people, like, what's the big deal, right? Like, it's just a piece of paper. I mean, what's the point of putting down all the contents of your mind onto a piece of paper? And I feel that it is so effective because when we're anxious, stressed, or overthinking, our our thoughts are these like abstract. They're all abstract and they're all sort of like going around in a tornado, and you can't make it out, right?
True.
But when you write it down, you capture those abstract thoughts, you pin it down on a piece of paper, and it becomes concrete because you're writing a solid idea. So from something abstract, it becomes concrete, and you leave it on that piece of paper, and it no longer goes round and round in the tornado in your mind, right? So brain dump is super effective, and if you're new at journaling, try it out because it's just so quick and so easy, and there's really no perfect time to do it. You kind of like in the middle of work, you can do it I do it before I sleep, so my mind is clear right before bed, and I can just pick it up the next day when I'm ready, right? So yeah, that would be my top tip for people who are new to journaling.
I think, yeah, the brain dump itself, because for me, when I just write a topic brain dump for me in my journal, I'm like, what should I write? Because I'm very much, like intrigued, and I'm very much driven to write on the productivity list, and then it
Yeah.
it kind of like takes me there, and I completely forget about the brain dump. But that thing is like hampering me in my productivity. I ignore that fact, and I think it's very important that for people or the beginners who want to do that, it's very a good thing to start, like where you are at and reflecting on yourself.
Mm,
Um, the so, are there any other things that you would like to add on journaling for your like what?
journaling.
Yeah, if there's.
So actually last year I sort of did this informal survey, which was really just me asking, a lot of people what they felt was stopping them from writing or
Mm,
journaling. And it came as a surprise to me that, majority of the people said they felt they needed their journal to be perfect. Like, they needed their handwriting to be super nice, and, they need their words to be grammatically correct. And the thing that I love about journaling is that no one's gonna see it. It's for my eyes and my eyes only.
True.
Sometimes I don't understand the things I wrote the past night. That's how bad my handwriting is. And uh most of the time it doesn't make sense. Like, it's just a bunch of thoughts. And my advice, or my suggestion rather, for people who struggle with that perfectionism, is to start writing in bullets. So fragments of sentences. Like, you don't have to write full beautiful sentences. Just write in bullets. And I would suggest not to buy an expensive, nice looking journal.
Hmm.
Use something that is ugly, honestly, or just, cheap. Because if it's not something that's super nice, then you take the pressure off of, having to make it, legible, and having to make it beautiful. If it's something cheap and free, like my own journal, then you're free to do whatever you want with it. So, yeah.
I totally agree on that. Because the Instagram and the Pinterest that we have put a lot of pressure that your journal needs to be like this kind. You need to have this thing. This you need to write this thing on your journal. And when you compare to yourself, it is it is like disastrous. Like, it does not
Mm.
look in any angle the way it looks in the Pinterest. Come on, how can I
Yeah.
do that? They are artists.
Yeah.
They are very artistic about the journal, and I'm like, it is not looking even in an inch. And the putting the pressure, and then you completely forget like why in the first place you get the journal, right? So I think
Yeah.
it's very important suggestion to whoever is starting. And I also think another thing is maybe like have a blank papers, not have
Mm.
a formatted kind of journals, because that way you can be very creative about how would you like to have a journal.
Mm-hmm.
Because when I get the one with the formatted one, I feel like very restricted with like I have to write
Mm.
this and that. So that is also something maybe someone can feel helpful. So
Yeah.
thank you so much, Carmela, doing this
My
with me
pleasure.
with a
Yeah.
lot of technical difficulties we
Yeah.
had, but I think it's the part of the process, to have keep our mental health very calm during that conversation at will. And I was like, when the first time, for the first three time when we did not get the live, I was
Yeah.
like, we are going to talk about mental health, so keep put the patience on. You have to be patient. Come on, you cannot be like, oh, it's not happening. I was like, be patient.
Yeah.
Just be calm. And I was like, because
Mm-hmm.
inside it's like, oh no, the event is not going well. The kind of the backstage
Yeah.
thing. But thank you
Yeah.
so much, and thank you so much for cooperating with me throughout this journey. It has been an absolute pleasure, and I really learned so much of things from you. I haven't moved to the clinical field yet, but I feel like listening to you and you being the person out there and relating with you in different matters, that is very helpful for me. And I feel that people listening to us can also take some insights and practice better mental health. Yeah.
I'm so glad to hear that. Thank you for having me, for inviting me, for giving me this opportunity to speak about mental health. I haven't had a lot of, chances to do that recently
Mhm.
because it's been so busy. So I'm so grateful for this. And I'm honestly just grateful that I have you as part of my letter C,
Yeah.
connection in the veterinary industry. So it helps me with my mental health too.
It does.
So thank you.
Yeah. Likewise, Carmela. I am very grateful that I found you, and I have to tell to my audience and to our audience that you were the first person in that. Let's say it was a Zoom session, and you were the first person that sent me the message, and I was like, "Who's this?" And I don't know her, and I'm like, "No." And then I checked your Instagram, and sometimes it can be like spam, and
Yeah, yeah.
yeah. So I
Yeah.
need to double check on that. But I'm very grateful that I attended that event and get connected with you. So thanks
Mm.
so much for that. And a happy new year. And I wish that
Happy New
2022
Year.
has so much for you. And
Oh,
yes, thank you so much again.
thank you, Bima. So good to spend time with you again. Good night to everyone. Good morning and good afternoon from wherever you are. Yeah, and Happy New Year.
Yes. Thank you, Carmela. Okay, with that, I think we can turn this off. Let me see.
Mm-hmm.
Mhm.
All
Okay.
right.
Bye.
Bye.
Thank you, Donna, for that. Thank you, everyone, for joining in and sticking to it till the end. It had we all had a lot of technical difficulties in the first, but we finally made it. And thank you for all your support. I absolutely admire the kind of support that you have shown in the last year. 2021 has been a roller coaster ride for me, in terms of growth, in terms of reflection, and I cannot wait what 2022 has in the box for all of us. Happy New Year again, and I hope to see you in our next Instagram live with another guest and talk about something that is helpful for our profession as well as for all of us. So, with that, see you next time. Bye bye, and Happy New Year again.